like to quickly introduce you to the National Centre for Accessible Transport, or ncat. For those of you who don't know, ncat is an evidence centre funded by the Motability Foundation to convene and commission high-quality evidence with the aim of creating a barrier-free transport system. It brings together 6 organisations across academia, inclusive research, consultancy, policy making, human-centred design, and grant making. Together, we generate insights, translate research findings into policy positions, and accessible, digestible information, with the aim of promoting the adoption of evidence-based practices and policies. But I'll now pass over to James to kick us off.
Welcome to this overview of the National Centre for Accessible Transport's project on how public attitudes affect inclusive travel. This project, conducted over the last year or so, explores how the attitudes and behaviours of non-disabled people impact the travel experiences of disabled people and what interventions might be most effective in creating positive change. The findings are highly relevant for decision makers in transport policy, as well as for disabled people, their families, charities, and anyone working in research. Our aim is to provide actionable insights that can inform strategy, policy, and practice, and ultimately make transport more accessible and inclusive for everyone. My name is James Noel Pollard. I'm a behavioural scientist in the Future Mobility team at WSP, and I've been working on ncat projects for the last couple of years. So to ensure a robust and inclusive approach, the research was structured in 5 key phases. We carried out a desktop review of existing literature and interventions. We held some focus groups with disabled people, which were run by RIDC, the Research Institute for Disabled Consumers. Development and testing of interventions and workshops, and running these past an experts by experience panel to understand how they felt about the interventions, and then a large-scale survey with over 1,400 non-disabled participants, capturing their attitudes, behaviours and perceptions of potential interventions. Then we pulled together all these findings in a summary report to form conclusions and provide some recommendations. So the challenge, disabled people make 25% fewer journeys than non-disabled people, a figure that's relatively unchanged over the last decade or so, but there's a bit of debate about that at the moment. But either way, we know that disabled people make fewer journeys, and 59% of disabled people report experiencing negative attitudes or behaviours when travelling. And for those with non-visible impairments, that rises to 86%. These negative experiences can deter travel, impact mental health, and reduce independence and well-being. So what is it that shapes public attitudes? Well, public attitudes are influenced by knowledge, experience, and context. More frequent, meaningful contact with disabled people leads to more positive attitudes. And attitudes vary by type of disability. So visible impairments often elicit more empathy than non-visible disabilities. And there's a gap between what people say they would do, such as offering a seat or moving their luggage, and what they actually do. And that can be influenced by a wide range of things. So it might be social discomfort, it could be uncertainty, it could be unconscious bias, it could be all sorts of things that are going on that people just aren't really sure what to do in those situations. And so we identified a range of barriers working with disabled people. And so disabled people identified a lack of awareness and understanding of disability among the general public. Politics and media reinforcing negative stereotypes. Accessibility barriers and negative attitudes have significant impacts on confidence and mental health, and that many of these issues stem from disabled people not being included in the design of transport and services. They haven't been party to how the systems have been shaped. And so we came up with a range of interventions, and we developed these working with that experts by experience panel, and we trialed these out. So firstly, education. So especially for children and young people, this is seen as the most highly impactful area. So disabled people should be involved in helping to develop that educational context. But we need to speak to children and set the scenes and set those habits right from an early age. Luggage storage causes a lot of conflict because there's a lack of space over those priority areas. And so more luggage space by seats is the preferred option for travelers. So they don't have to leave their luggage behind at the far end of a train or the bus. And then they can also leave space for disabled people. Public awareness campaigns, so videos on social media and on public transport, are viewed as the most effective formats. Targeting people when they're kind of susceptible to new messages is really important. So sowing the seeds with social media videos, but then in public transport, contacting people when they're in the position of changing their behavior. Enforcement. So fines for blue badge parking violations more impactful than just messaging alone. But fines in general aren't really issued. And so if people aren't being punished and people aren't being fined and people aren't suffering the consequences of doing the wrong thing, then that behavior essentially becomes normalized and becomes something that is acceptable. So we need to make sure that when there are enforceable actions, we need to take them and we need to make sure that people see these as something that they can't do. Signing and messaging, so make sure that signing is bold, emotive, audio messages to help remind people about priority spaces and invisible disabilities. So again, do this at times when it's just in time, so it's where the conflict is arising. Badges and lanyards, there's a need for singular, well-understood design to avoid confusion for people who are comfortable wearing a badge or a lanyard. The sunflower lanyard, whilst it is clearly about disability, you can just buy them from Amazon, and there are people who just buy them from Amazon so they can get seats. But similarly, there are also people who don't know what they mean, and they don't know whether that means just non-visible disability, and that therefore that person can sit anywhere, or does it mean that you need to give up a seat for them? And then reporting. There's currently no single place for disabled people to report positive or negative experiences. Without this, we don't really know how large a scale this is, and we can't really sort of start to devise more thorough interventions because people don't know where to go to speak to authorities about this. And as a result, lots of the issues that arise get brushed under the carpet or get ignored. So the study led to several key conclusions. As I mentioned, education is probably the main one. We need to prioritize education, especially in schools, and try and combat that prejudice and ableism from an early age. If we can break that habit early, we can really see some change. And involving disabled people in that curriculum development will ensure relevance and authenticity. Designing infrastructure that matters to people is important. So addressing the practical barriers, such as luggage storage, can reduce conflict and improve access. And involving disabled people, again, in that design process is essential. We're suggesting co-design and doing it with disabled people rather than to disabled people. Effective communication. So make sure any public awareness campaigns use engaging formats and videos and be consistent and inclusive of all types of impairments. Signing and messaging should be bold, emotive, and placed where it is most visible and relevant. Making sure that we fine and enforce rules and accompanied by clear information that there is a need for accessible and well publicized reporting mechanisms for both positive and negative experiences. And we really focus on the positive there because actually we need to know who's doing things well so we can compliment them and we can build on that and we can find out what's going on that's already out there, who's working well in this area, and how we can combine those. And then actually, they're combined interventions. So the most successful approaches combine education and awareness, incentives for good behavior and penalties for bad behavior. So the way we see it is carrots, sticks, and education. You need a blend of all of these three. You can't just incentivize good behavior without punishing the bad behavior. You can't just punish bad behavior without offering people alternatives. And people need to know what is going on. So the implications for decision makers from this work in transport and policy. So transport operators and bodies need to prioritize inclusive design, co-design, luggage space, and address that space issue on public transport. and ensure robust monitoring and evaluation of those interventions. It's not good enough just to roll something out and ignore it. You need to look at how it's working. Policymakers need to think about supporting inclusive education, fund awareness campaigns, enforce regulations, and create accessible reporting systems. And then lastly, local and national government need to use the opportunities such as bus reform and devolution that are going on now, these wider things, to trial and scale effective interventions. And again, involve disabled people in all stages of policy and service design. And the implications for disabled people, charities, and others. So for disabled people and their families, this research amplifies your voices. That's the aim of it. We wanted to really hear from disabled people and highlight the importance of your lived experience in shaping these solutions. For charities and those working in the sector, use these findings to advocate for evidence-based interventions to support campaigns for change. And then for higher education professionals and academics and researchers, incorporate these insights into teaching, research and outreach, and ensure that accessibility is included in all outputs. So just to wrap up, in summary, the ncat project on public attitudes provides clear evidence that changing public attitudes and behaviours towards disabled people in transport settings requires a combination of things: education, design, communication. By working together across sectors and with disabled people at the centre and heart of this work, we can create a transport system that is accessible, welcoming and fair for all. So thank you for listening. If you want more information, please visit the website or feel free to get in touch with us. Thank you very much.
Hello, everyone. Thank you so much for joining us today. My name is Luis. I am a senior researcher at the Research Institute for Disabled Consumers, otherwise known as the RIDC. So for the next 15 minutes or so, I'm going to be talking to you about the focus group study we did and some of the findings that came out of that. So last year, ncat surveyed 1,195 disabled people about the barriers they experience while traveling. And one of the statistics that really stood out to us was the fact that 59% of disabled people said that they had experienced negative attitudes from non-disabled people when traveling across all modes of transport. So this number and the survey showed us that the effects of negative attitudes are a significant barrier for disabled people when using transport. Now, I should say that when I refer to negative attitudes and when this research refers to negative attitudes, we are talking about the negative thoughts, the feelings, negative feelings and behaviors non-disabled people have towards disabled people. So from this 59%, ncat was interested in exploring and understanding what these negative attitudes are that disabled people face when using transport, how they affect disabled people when traveling, and also what interventions disabled people think would help overcome these barriers. So in order to explore all of this, we first did a focus group study, which we conducted with 14 disabled people, all of whom had various different types of impairments. So we had disabled people with mobility impairments, cognitive impairments, sensory impairments as well, in addition to those who had visible and non-visible impairments and access needs. And in these focus groups, we explored what these negative attitudes were that disabled people were facing. So there were three major attitudinal barriers that participants focused on in the focus groups. The first one was that participants felt that the public and transport staff had a very limited understanding of disability. So one of the things participants talked about was the treatment of non-visible versus visible disabilities. So disabled people with non-visible disabilities were sometimes questioned or discredited if they did not have any obvious or visible impairments or access needs, but were needing to use assistance or a priority space. So these participants felt that their access needs were treated more seriously when they quote unquote looked disabled. So if they had a white cane or an assistance dog or were in a wheelchair, so had these sort of physical and visible markers of disability. Participants also talked about the treatment of young disabled people versus old disabled people. So young disabled people felt or had actually experienced negative treatment because members of the public didn't always believe that young people could have disabilities, because I guess sometimes disability is sort of associated with older people. So once again, the message here was that disabled people who didn't conform to people's sort of stereotypical mental models of what disability should look like were often not believed, were discredited, and weren't always given the support they needed. In extension, disabled people also felt that members of the public had a very black or white understanding of disability. So, for instance, people incorrectly assuming that all blind people have no vision, or that all wheelchair users can't use their legs. And overall, just having this belief that, or failing to understand that health conditions aren't static and they fluctuate all the time, and that actually a lot of wheelchair users can still use their legs to some extent, and a lot of people with visual impairments can still see. So participants talked about how these incorrect assumptions were often used against them to discredit their disability when using transport. One of the second major attitudinal barrier that participants talked about was the fact that non-disabled passengers are sometimes abusive towards disabled people when using transport. This was something that was rather widespread amongst the participants, that most all of them had experienced verbal abuse from other passengers, having received threats of physical violence. I mean, participants described being sworn at, laughed at, sometimes forced off a train by other passengers, and also having their carers threatened and intimidated. One of the areas that often led to a lot of this conflict was when it came to wheelchair spaces and priority seats in, for instance, buses. That's something that really came up quite often. So in the focus group, participants described instances where passengers on buses did not want to give up their seat, or the wheelchair space had a parent with a buggy or somebody with shopping who didn't want to give up that wheelchair space, even though legally people in a wheelchair have priority over that space. In addition, passengers also talked about how members of the public didn't always respect the use of blue badges or lanyards by disabled people. So again, if a participant was using a blue badge parking, but they didn't look, quote unquote, look disabled, they were sometimes questioned by other members of the public, questioned as to why they were using that blue badge parking spot. Or if somebody was using a sunflower lanyard, they were questioned as to why they were using it. And the third attitudinal barrier that disabled people spoke about in the focus groups was that they felt that frontline transport staff sometimes did not support disabled people's independence and didn't provide equitable treatment. So participants felt that staff didn't always respect disabled people's agency. So they described feeling ignored and not listened to by members of staff who often made decisions for the passenger without consulting them directly. So for instances, there were experiences of disabled people being lifted onto a train by staff members and being refused a ramp because they were told they did not need it when the disabled person felt like they themselves needed the ramp. There were other instances where participants described instances where staff members would direct their comments or questions to the person standing next to the disabled person rather than speaking to them directly, assuming that disabled people couldn't speak for themselves. And lastly, participants also felt that staff were not always willing to help. So, disabled people sometimes feeling like a burden to staff who responded to requests for assistance with a reluctance to engage or provide help. This was specifically highlighted with bus drivers who, according to participants, sometimes were unwilling to lower the bus for disabled passengers or who refused to ask passengers with buggies to move from the wheelchair space. For this next slide, we're just going to show a quick clip from one of the focus groups where one of the participants is talking about some of these attitudinal barriers that we've just discussed.
But then after that, because I'm in my 30s, a lot of people will say to me, oh, you're a bit too young to be disabled. Why are you using a walking stick? It's like you're giving up. And it's just, it's really disheartening. Obviously, at the moment, a big buzzword is like the skyrocket in diagnoses for neurodivergent conditions. I only got diagnosed as autistic recently, and I often get, you don't look like you're autistic. How can you be autistic? You've got a teaching degree. There's still, because people assume they know what someone with an invisible condition should look like.
So like I mentioned, that was a clip from one of the focus groups, and in the focus groups, we also explored the impact that these attitudinal barriers had on disabled people. And one of the most critical impacts that participants talked about was how these negative attitudes that disabled people face when using transport have alarming implications on their mental health and confidence. So participants, they expressed experiences where they felt anxious and scared when using public transport. And obviously this was both due to the physical access barriers, but also the negative interactions that they had had with staff and other passengers. So participants talked about how these negative interactions had sometimes led to panic attacks, disassociation, and in some extreme cases, feeling suicidal. So it was sort of quite alarming to see how these attitudinal barriers had really harmed people's sense of confidence and safety when using public transport, and that this had made them less likely to want to leave the house, which leads me sort of perfectly into the next big impact that participants expressed, which is how disabled people are not using certain transport modes. They're traveling less and are not feeling like they're able to travel independently because of these negative attitudes. In the focus groups, participants told us that they leave the house less often because they don't want to face the negative attitudes. And so some participants expressed avoiding public transport altogether based on their past experiences with staff members or other passengers, and having to, choose to use private transport whenever they could because they felt it was safer. And lastly, participants also had a desire for independent travel, but they felt that this desire for independent travel was at odds with the realities of using public transport. So participants were frustrated at not being able to travel without having someone accompany them because of the physical barriers and the negative attitudes they faced. They didn't want to face them alone, so they sort of felt like they were being forced to travel with somebody else for their own safety. This is a quote from one of the participants in the focus group when they were talking about how the attitudinal barriers had impacted them. So they said that sometimes it's just easier to just stay at home and not even try. But like people say, I want to have a life, I want to get out, but it just takes a lot of energy and a lot of courage sometimes. So really touching upon that theme of how these attitudinal barriers sort of deter people from using public transport and living their lives independently. Lastly, the participants in the focus groups also talked about some of the solutions they felt could help address these barriers. So one of the solutions participants mentioned was that they felt that collaboration with disabled people was critical in the design of transport infrastructure and improving attitudes. So participants expressed that disabled people are the experts when it comes to their own access needs and access barriers in transport, and that oftentimes transport organizations fail to have an understanding of these access barriers and the nuances of different impairment needs. And therefore, it was critical to have the voices of disabled people from the beginning stages of design. Another solution was how education and awareness raising through humanizing disabled people, along with increasing understanding about disability and barriers, are key aspects for improving public attitudes. So participants particularly stressed the role of education and the importance of having young people be aware of disability from a young age in order to combat prejudice and ableism, so that young people would grow into adults and not have all of this internalized ableism. And lastly, participants talked about political and social change and a commitment to improving attitudes towards disabled people needing to come from the top. So they discussed the role of, for instance, government departments, political voices, campaigns, or public role models in shifting the tides of how society talks about and understands disabled people. So moving away from negative connotations that disabled people are often associated with and really trying to humanize disabled people. So that brings us to an end on the focus group portion of the research. Thank you all so much for listening, and we'll have an opportunity later on to answer any questions anyone might have about this research. Thank you all so much.
Hello everyone, my name is Vitus. I am a Transport Solutions Manager at the Motability Foundation. At the Foundation, we believe that transport should never be a barrier to disabled people living the lives they choose. That's why we work together across sectors and with organizations to find practical solutions to the challenges disabled people face. One way we do this is through our support of ncat, which we funded as an evidence center to deliver applied research and exemplar projects. They are bringing real evidence and lived experience together to show what needs to change so that accessible transport can be achieved. Thank you again to everyone who has shared their insight and experiences today. A powerful and consistent message has come through, one that echoes what we have heard from disabled people time and time again. Accessibility is not only about vehicles, stations, or technology. It is about people. It is about attitudes and behaviors. Because when those attitudes are negative, they do not just make journeys harder. They add unnecessary stress, leaving lasting memories, and can discourage disabled people from traveling, from participating in their wider community, and ultimately from living their lives to the fullest. At the Motability Foundation, our new strategy is focused on building transport equity. This is something we can only accomplish with collaboration. So we want to work with a whole range of partners across the accessible transport space. Yes, infrastructures can be built and technology can advance, but true inclusion will only truly be achieved when everyone in the transport system, from drivers and planners to policymakers and everyday non-disabled travelers truly understand and value the lived experience of disabled people. Over the past few years, the research we have commissioned and grant funded has deepened our understanding of how negative attitudes and behaviors impact disabled people. The Invisible Barriers report from ncat is an important step towards identifying practical solutions. This work has helped us see how closely attitudes are intertwined with system design. It is about education. It is about vehicle design. It is about creating an inclusive environment. We hope these insights will enable us to reflect on how we and those we work with can make public transport more welcoming and accessible. Because inclusion is not only about individual behaviors and actions. It is also about the cultures within organizations and the incentives and structures that shape the wider system. This research will guide how the Foundation and others think about future approaches and where different interventions can best work together to create meaningful change. ncat's research gives us a strong foundation to build on. It helps us understand which interventions already exist and where the gaps may be. Working with behavioral science, we are taking the next step in exploring key questions such as which groups can we most effectively influence? Who is most receptive to change? What kind of interventions could be both practical and impactful? And how can we measure progress meaningfully over time? Behavioral science helps us understand why people do what they do and how their choices, attitudes, and behaviors are shaped by their environment, by social norms, and by the way information is presented. By applying this understanding, we can design interventions that encourage positive change, whether that is improving awareness, shifting perceptions, or prompting more inclusive behavior on public transport. Changing attitudes is a long-term, collective effort. We hope this conversation continues and partners work across the accessible transport space to build on what this research has revealed. Thank you to everyone who contributed to this research and to all of you joining us today. Your insights are shaping us how we and the wider transport sector think about what truly inclusive mobility looks like. We look forward to continuing this work together. Thank you.
Thank you very much to Vitus, Luis, and James for their presentations and going through what is an enormous project, an enormous amount of information and insights that we've gathered into what is an extremely important topic. And Vitus said it at the end, accessible transport isn't just about ramps or physical infrastructure. Attitudes are as important to allowing disabled people to travel when and how they like as much as important as ramps are. So this research really built on the fact that we didn't really know much about what non-disabled people thought and how they behaved. And so that is, for me, one of the really strong aspects of ncat, that we can look at these large system-wide problems and bring a different set of views and insights into that. And we've got an opportunity now for questions. Some very diligent people have already sent through some questions. The first question I would sort of want to ask James and Vitus and Luis is, what's the one main takeaway from this project, from all your interventions and your work in this, that actually you would sort of champion most? What's the one sort of headline thing to come out of all of this? James, if I go to you first.
So for me, I think the thing that really came out is, and I don't know if this is a proper answer to your question, but actually it's really difficult, and that oftentimes people think that there's a one size fits all solution to some of these challenges, but it goes very deep into people's sort of psychological triggers, their levers. It affects different people with different disabilities. It affects different people. So the kind of the learnings from this are, we need to keep focusing on this, and there's a lot more that we can do in this area, because there are so many variables that we really need to get on top of. And, I do believe that there probably, in the future, there is something that will catch most of the issues, but we need to keep working on it and find out what it is, and then, move beyond the behavioral stuff to the actual physical infrastructure, design and development of public transport.
I'll jump in as well. Um, I think for this piece of work, it's interesting that there was a lot of conversation about sort of the larger societal issues that lead to negative public attitudes. So, for instance, people's, like I was saying in my part of the presentation, people's sort of simplistic mental models of what disability should look like, that people don't really understand the nuances of disability, that a lot of disabilities can be invisible. So there was a lot of conversation about sort of going beyond transport and just sort of tackling the education system and how we teach young people about disability. So that was a really important part of this project. But also the idea that actually there are a lot of practical infrastructural barriers that lead to these negative attitudes. So the main one being the wheelchair space and priority seats, particularly if we're talking about buses. So it's the fact that buses only have one wheelchair space and that a lot of different passengers are competing for that space. It's that barrier that leads to a lot of tense and conflicting interactions. So it's sort of, we need to tackle this issue via both sort of societal changes, but also infrastructure changes. And both of those can feed into each other and they oftentimes overlap. So it's important that we have sort of a multi-perspective on this issue.
Vitus, if I could ask you a question specifically about more detail about how Motability works, or the work that you're planning to do in public attitudes, and what are going to be your sort of recommendations and strategies for that going forward?
Yeah, thank you, Gordon. So I think talking broadly first is that the Motability Foundation, we are a pan-disability charity, and we all want to build a future where all disabled people have the transport options to make the journeys they choose. So yes, we oversee the delivery of the Motability scheme, and we help those most in need of support to access it. But we also work with a range of partners to create inclusive transport options. So that's through grants, it's through innovation and research that can make lasting change. In terms of work we have done, we have funded and supported a number of disability charities and organizations such as Autistica, Mental Health Foundation, and RNIB to carry out research centered on the lived experience of disabled people's voices. And the research we have seen is that it always talks about public attitudes being a psychological barrier that the disabled people face. In terms of working with other disabled people, we also have a scholarship project, and that sees us supporting disabled PhD students to undertake research on accessible transport. So we are working with people with non-visible disabilities and those who do not use mobility aids. Last but not least, we have also committed to funding ncat. So, and you are working with disabled people, working with disabled people's organizations, transport and research experts to generate evidence on accessible transport and, of course, on the public attitudes.
Brilliant. Thank you very much. There was a theme between Luis and James's presentations around enforcement and people feeling that they don't have a voice on transport. From your perspective in doing the research, what were the ways you think transport providers and the government can strengthen that enforcement ability so that disabled people know that somebody has their back when they're traveling on different forms of transport if they face negative attitudes?
I think one of the main components when we think about holding transport providers accountable is this idea of transport integration. And there was a question in the chat as well about let's see if I can find it, just about how the UK government is planning on sort of taking over the railway system and the railways bill that's coming into play and how that will affect accessibility. I think one of the exciting things about the railway bill is in integrating all transport modes, or in this case, integrating rail. Hopefully, it can be easier for disabled people to know who to complain to when something goes wrong, because I think one of the difficulties that many people face, non-disabled people and disabled people, is that when something goes wrong, it can be very difficult to know who to call and who to complain to. For instance, if you're traveling by train, do you complain to the company that runs the train station? Do you complain to the company that runs the train itself? There's always various different numbers, and there's so many sort of bureaucratic loops that people have to jump to in order to complain. And a lot of disabled people have told us that they oftentimes just don't have the energy to complain, because if something goes wrong during their journey, that is already such an energy draining occurrence, that then to also have the energy to go through the entire complaint process is just very unrealistic. And so a lot of times transport professionals and train companies simply aren't aware that things are going wrong. And so then it's hard to sort of, because complaints in a way are data points. The more complaints people make, the more transport networks know, okay, this specific thing is going wrong. For instance, the wheelchair priority space is leading to a lot of issues, so we need to act on it. So until passengers can have an easy way to make a complaint, it'll be really difficult for transport networks and transport companies to be able to enforce change. So we need to make sure that we're integrating those complaint processes and that there is just one place for any passenger to go make a complaint about any journey. So yeah, so I think hopefully with the Railway Bill, and as we talk about transport integration and integrating all stations and trains together, it'll be easier for people to make complaints and know how to hold services accountable.
Right, thank you, Luis. James.
Probably not much to add on that, apart from to say that, you know, lots of things that organizations and that's being done and that's being complained about is, we know it's illegal. We know it's against legislation. We know it's against regulations. It's that enforcement. And until that enforcement is done, until people see others being punished for their poor lack of action, I think very little will happen. You know, the example to go to on that is, you know, if you think about jaywalking in America, which is such an odd concept to people in the UK, it's enforced, and therefore people don't do it. And so that you see the consequences of that, in that people don't do it, even though it's a slightly odd, archaic rule. And until we start enforcing the rules that we have, people aren't going to follow them. And I completely agree with Luis that, you know, we need a central point and collecting that stuff, but we also need to enforce it.
Thank you. And I suppose picking up on that point of the variations internationally, jaywalking and stuff, in doing this work, did you come across any examples internationally where transport providers or the system actually deals with the issue of poor attitudes towards disabled people in transport, or who's leading the way in this, or is it sort of common across the world, if you came across any of that?
Well, the work that we found actually is that the UK is really far ahead of everyone else, which is a really sad indictment on the state of the world. But the UK actually, at least we've got a dialogue here. There are other countries that are doing it very well, and we know that, you know, when people build things from scratch, it generally gets built better. When you're trying to retrofit things, that's where it's difficult. But the UK, at least there's a dialogue about it, which I don't think there is in lots of countries.
Yeah, it's good to hear we're leading the way in something, but it's still a lot of work to do. I suppose the inevitable question is, what's next for this, out of this research, and what's next? What's NCAT going to do in this area?
To be honest, more. I think just in which might be it's kind of a bit of a cop out of an answer, but there's more to do, and there's more to look at, and there's more research to consider. I mean, in a dream scenario, we would be able to go out and conduct some more research and get some more interventions designed and set up. And I know that at Coventry University, they've got some really brilliant facilities there. I was in Ireland a couple of weeks ago, and I spoke to someone from the National Wayfinding Centre over in Dublin, and they're doing some really exciting stuff. So I guess what's next is, whether it falls under NCAT or any other work, I think, we've got to look at what people are doing and do some more in-person research, because desktop research and this work that we've done is really helpful as a really jumping off point. But until we see, and I know Vitus mentioned sort of the behavioral science and the contextual factors, until we see things on the ground in person, it's very difficult to understand what will have an impact.
Thanks, James. And the Wayfinding Centre in Dublin's a fantastic place, and they really deserve a mention because they're doing some fantastic work there. Vitus, what's next for Motability in this space around public attitudes? What's next on the list that you're going to do?
Yeah, so in the webinar component, I mentioned we are taking the next step. So looking at questions about which ones would have the most impact, what are the interventions that we should be looking at, what might be the most feasible ones. I think exploring those next questions, using research, using quantitative or qualitative, a mixed method to understand what's the most effective next step is probably what we would do next. I think I saw a question on the chat about any plans to focus on attitudes experienced by disabled passengers when receiving support from transport staff. I think a key step for this research to go forward is to ensure that the findings are being picked up in ongoing works and initiatives, right? So we mentioned that the railways being nationalized, so they are looking at accessibility. Is there some way for us to make sure that these findings go forward into their plans for what comes next when it's being nationalized? I also know that NCAT has a project on accessibility, education, and training landscape. So that's something that's being worked on currently. What are some ways to make sure that these findings are being picked up and being pushed forward to ongoing works?
Yeah, there's also a project going on about complaints as well. So NCAT's doing quite a lot of the work that perhaps the transport system that's currently kind of fragmented, and even the rail system, we're trying to look at the broader, more strategic points around that. Even when we did this research back, I think it was probably about 6, 8, 9 months ago, the narrative around disabled people in society in the UK has changed considerably, and I think it's more what disabled people can do is more of this stuff, more raising awareness and more challenge of that behavior which stops people from feeling comfortable and able to travel. But I think it's a much bigger debate and change in narrative in our nation and around the world around diversity, inclusion, and the role of and place of disabled people. But I think it's a very well made point, and it just shows the complexity and the sort of connectedness and the contingencies that are in place that mean that it's not just ramps, it's not just level access, it's about attitudes, and it's about leadership, and it's about messaging. And I think if there's anything that I hope you take away from the session today is that the work of NCAT is trying to look at all of those wider systems and raise awareness of the impact of people's attitudes, the impact of physical barriers that will stop people from having an independent life and do and go where they want when they want. But I think initiatives like NCAT, the funding at Motability Foundation, the constant campaigning and raising awareness of organisations like Transport for All are really important. So what I would say is get involved in things like this. Sign up to the CAT panel, which allows people to join and have a say in this research. But it's not going to change overnight, and we just hope and pray that the narrative that comes out from the government and from others changes, so that the sort of constant attacks around disability and around benefits stops, and it's a much more nuanced and much more reflective conversation about how people live their lives in this country at the minute. I hope that was useful and information. There's a massive amount of research and data that sits behind this. So I would really recommend you visit the ncat website, which is just ncat.uk, and access that information and get involved in the Community of Accessible Transport panel. Thank you very much for your time today. I really genuinely hope you got something out of it, and it helps move things forward and think differently about behaviours and attitudes on transport. And as I say, follow NCAT, get involved.